So for everyone who's new to the webinars, to the webinar series, welcome and thank you for joining us this evening. My name is Rahini Bajakal and I'm on the team at Plant-Based Health Professionals UK as a nutritionist. And I'm extremely excited about this evening's webinar with the incredible Michelle Fedele, who I'll introduce shortly, talking about a topic that is incredibly important. And I think it might be the most practical presentation we've ever had. So really looking forward to this one. This wouldn't be possible without your generous donations, as well as the support of our sponsors, ProVeg International, veganfitness.com, who kindly lend us the Zoom platform, and the British Society of Lifestyle Medicine. For all healthcare professionals in attendance, you will receive a copy of the slides as well as a CPD certificate, which gives you 1 CPD hour for attending this webinar. Plant-Based Health Professionals UK is an organisation based in the UK, but with members all over the world, that's dedicated to promoting the benefits of a sustainable whole foods plant-based diet. And we're especially keen on educating and making aware healthcare professionals. But we also have many members of the general public who are part of our group, and I'll be providing some more information on joining us as well shortly. We're really excited about our next webinar, which is with another fantastic and legendary Canadian dietitian, Brenda Davis, and paediatrician, Reshma Shah. It's going to be an absolute must attend, and it's on the 12th of November, and it's an hour-and-a-half bonanza, so please join us, and they'll be discussing their new book, Nourish. But this is an absolute must for anyone, even if you don't directly work with children or have children yourself. I've learned so much from this book, and I was chosen as an advanced reader, which I was very excited about. And I urge you to sign up for this, and all the details are on our website. We also recently launched a 21-day plant-based health challenge, which is completely whole foods plant-based and provides recipes, nutrition advice, and motivational tips. So go and check that out on the health zone of the Plant-Based Health Professionals UK website. As mentioned, everyone is welcome to join as a member. And if that's not possible for you right now, you can visit pbhp.uk to subscribe to our newsletter, donate via pbhp.uk/donate. And we're also really active on social media on Facebook, Instagram, and Twitter. I'd now like to welcome Michelle Fedele to start the webinar, and do stay tuned because she'll be joining us for a Q&A after this. Really excited for this one. Michelle has been a practicing registered dietitian for over 20 years. She's based in Ontario, Canada, and she set up Plant-Based Canada along with Dr. Shireen Kassam's sister, Dr. Zara Kassam, which is a fantastic organization, and I definitely urge you to check out their resources. So I'll hand over to you, Michelle, and then I'll see you back for the Q&A shortly.
Perfect. Everyone, thank you so much for having me. It is such an honor and my very first time presenting in the UK. So thank you so much for welcoming me into your home this evening. So I'll start off the presentation and looking forward to your questions after. So I'm just going to open this up for you. All right, so here we go. So as Rohini mentioned, I'm a dietitian and I specialize in oncology. I have been working in oncology for my entire career, which has been almost 20 years. And so hopefully this will be helpful for you and helpful for you to help with your patients. And if any of you out there are cancer patients listening to today's presentation, I hope this will be helpful too. All right, so let's get started. So, as we all know, that nutrition is really medicine. And of course, those undergoing cancer treatment must go under systemic and radiation treatments. However, food really can be a savior and definitely a medicine. The importance of nutrition and the role of a dietitian is to really help the patients feel part of the process. Often they are coming to the cancer center and they're told, this is your treatment, this is when it's starting, this is your schedule, and they have no other say in what to do. So giving them the power of what they eat and how they can be a partner in this is really so powerful. Nutrition during cancer treatment really helps to minimize symptoms. In addition to medications for nausea and other symptoms, nutrition can play a huge role. The nutritional needs for a cancer patient is quite different than those who are not going under treatment. Fluid for me is the number one importance for any patient undergoing treatment, as well as protein intake, and to make sure that they're having small frequent meals to help with symptoms and to minimize any weight loss. So I'll start with fluid, since that is my most important to me part in the nutritional requirements. So it is essential. And down below, you'll see that I wrote down some of the calculations that I do use to figure out how much people should drink. Often as healthcare professionals, we say a blanket 8 cups of liquid a day, but we can be very specific, and this will help the patient know what their minimum requirements are without any nausea or vomiting or diarrhea. Because once that happens, we'll have to start to use that initial number as the base and then move up from there to help replenish any losses. Another important thing that I often hear from patients is that they say, I can't drink 8 to 10 cups of water. Well, it doesn't have to be water. And in fact, I often say not to pick water because there are no calories in there, there's no protein, and it's kind of empty empty fluid. So people tend to drink a lot of water, get full, and then don't want to eat. So often when I see people losing weight, either they're drinking too much tea or coffee throughout the day, which I did write as part of a fluid. However, I've had some patients who drink 10, 15 cups of coffee a day and don't want to eat anything. So that's not good either. So I work on different strategies on how to make this fluid more meaningful, and we'll get into that in a few more slides down the way. Protein is extremely important. It helps the patient keep their immune system strong, and probably you see the patients when they come to you, or those out there who do have cancer and who are listening, lean muscle tissue is really the first that you notice to be going away from your body. It kind of like the clothes may fit you differently, they may hang off of you. That's the first thing to go, is that lean muscle tissue, and it is so hard to get back. So before all the loss starts to happen during treatment, it's really essential that if a dietitian or even any health professional listening gets involved early, can help make suggestions for them to stop the reduction of the lean muscle mass and obviously start to rebuild as much as they can, keep their immune system strong. So here is some calculations for you. Again, I believe in being very specific, and I tailor my assessment to each patient as an individual. So typically for cancer patients undergoing treatment, systemic or radiation, is about 1.2 grams of protein. If they're going to be going under any bone marrow transplant, it could go much higher than 1.4, even up to 1.5, 1.8, depending on the situation. However, there's also, some criteria of past medical history you always have to take into account. Do they have kidney disease? Do they just have surgery? Are they going to go for surgery? Is there any other issues going on? So even though this is a statement of 1.2, 1.4, I'm extremely flexible and definitely do a tailored assessment for each patient. And I put this interesting fact down because whether the patient comes to me being plant-based or not, they already do not want to have any meat. They've already lost their taste for it. So this becomes a key opportunity for me to help introduce plant-based eating and help them get used to this way of eating that's also going to help them and their whole family. Here's some protein sources. Now, of course, we talk about not eating red meat or processed meats. And I know you had a presentation earlier from Dr. Kassam about, prevention. And right away, I start to open in the topic of picking protein sources that are not animal sourced. And there's some examples at the bottom, but I also take a complete diet history, very specific of what they want to eat. And I also take a food frequency. And a food frequency, for those who are not familiar, is a kind of like a quiz to know how many things they usually eat. What do they normally have? Do you normally have dairy products? Do you normally eat pasta? Do you normally skip dinner? So I can kind of see how they are. And then I really try to work on using non-animal sources of protein to help fill in the meals and help them plan meal plans. Calorie needs. So this is a very interesting topic. As patients go through chemotherapy and radiation, they don't want to eat anything. And this is the time when they need to make sure they have their calorie needs as high as possible. So the requirements that are general for patients undergoing the stress that their body's going under is between 30 to 35 kilocalories for every kilo they weigh. Again, that is completely flexible. I have to look at their current BMI. Are they underweight? Are they obese? And with obesity, it's a very interesting topic. I've had many patients who come to start systemic treatment that are quite obese, and the BMI is above 40. And they're often told to lose weight. But what I would like to bring to your attention is that those who come that are obese, don't take it for granted that they could be malnourished. There's a lot of obese people who may seem to you as eating too much, but they could be extremely malnourished because the quality of their food, it has not been good leading up to this point. So this is a great opportunity to start to introduce quality and plant-based and moving forward to healthy lifestyle. So these are the type of symptoms that I often see. Of course, this is not an exhaustive list, and I'll help you through the next slides kind of have some strategies on dealing with this with food. So diarrhea, a funny little thing for you is that my nickname at the cancer center is Diarrhea Lady. I know that sounds awful to you guys, but I really hold that name to my heart because I really help those undergoing radiation or chemotherapy that have a lot of diarrhea. For example, colon getting radiation therapy, they suffer a lot with diarrhea. Also those with ostomies, I see a lot of those patients as well. So they often feel like they can't have any vegetables at all, but that's not true. There are many vegetables that have a lower fiber intake that are actually going to be helpful to get some nutrients and vitamins in and replenish some losses of potassium and sodium while they're dealing with the diarrhea. So I put the list here for you. And of course, to bring to attention like tomatoes, how it says peeled and seeded. I also take into account celery as well. If those patients have ostomies, obviously I remove those from the list. Those undergoing radiation for lung, I do take away all the sharp vegetables like the celery, like the lettuce as well, and cucumber, and we definitely tailor it. But this is kind of just a broad list. Fruit as well. So patients feel they can't have any fruit because they think of it as sugar. However, it's still important for them to get the hydration from the fruit and to also get some good soluble fiber as well. So here's a list, again, not exhaustive, and I would definitely have to make adjustments with any of the seeds or any skins or membranes that may cause issues for people who have ostomies. Now, grains is the big one. It's interesting because people come to me and say, oh, I've been eating really healthy, having whole grains, but I'm having all this diarrhea. So it's hard for them to imagine that what's healthy in reality and in what's perfect land is not healthy for them right now. And so often I have to change their mind that they have to pick these white, not a whole grain products. And I try to explain to them that, typically this is not something that I would encourage, but at this time it's healthy for you because having continued diarrhea and losses of electrolytes is not helpful. This is a very huge bone of contention that people are reluctant to change to the suggestions I have listed here, but I do try to remind them that it's a very temporary course, probably 6 weeks or less, and then we can go back to working on some healthy and incorporating fiber again, both insoluble and soluble. And the difference, if you're not aware, is that the soluble fiber I try to push a lot and encourage during a diarrhea course, because that's the fiber that helps bulk things up. And that's what you want, especially those with or without an ostomy. And insoluble fiber are the skins of the fruits and vegetables that we have to be mindful not to push in too much. And once the diarrhea is under control, I recommend for them to start to reintroduce fiber no more than 2 grams every 2 weeks and go very slowly and keep a food diary. Here's a very quick day of a meal suggestion. As you can tell, it's pretty plain, pretty bland, but definitely this is a good starting point if they've been on fluids only and then they have to start to reintroduce solids again. This is a good way to do it. I put decaf coffee because caffeine is a trigger, for diarrhea. I also put dairy-free milk. If those individuals that you're dealing with are not dairy-free, I would encourage a lactose-free product because it's the sugar in the milk that's going to cause the diarrhea to get mad and become worse. I also write diluted fruit juice. I'm not a fan of doing fruit juice during diarrhea. However, I do understand that sometimes people need variety. So there's a quick little day for you. Constipation is a huge problem with cancer patients. Not only are they drinking less because they don't feel like it, they're on lots of pain medications, which definitely can slow down the gut and cause constipation, which then it creates an entire cycle of not eating, of feeling nauseous, of feeling constipated, of not drinking, of losing weight. And this vicious cycle goes round and round until you're able to have the dietitian or another healthcare professional interject. And it's really important to bring it up with your patients. How are your bowels? How are your bowels? I know it seems like some people feel embarrassed to talk about it, but I try to make it as part of my normal conversation. And once we break that ice, the patients are far more comfortable speaking to me about it. So I put that blanket statement up top from 8 to 10 cups of fluid. Notice I did not put water. However, I would encourage you to use those exact calculations to help the patients meet their goals. I would also want them to know to include the skins and fruits and vegetables if they can, if they don't have an ostomy or risk of bowel obstruction. And also hot beverages, even warm water, help to stimulate the bowel and to get things going with peristalsis to help the people have a better movement. Restore Lax is something we often recommend. And also trying to do some bran. And if they can, incorporate some nuts and seed, dried fruit into their daily intake. Here are some food suggestions. You can tell this is now the insoluble fiber to help things move. And I have a really good suggestion coming up that you might want to take some note of a great recipe that takes no time at all to make up and patients can use on crackers. Just to bring it to the bottom, I did put caffeine containing beverages because, as I mentioned in the previous slide, caffeine is sort of like a little precursor to help the bowels get going. This recipe is a great recipe. I originally got it from my friends at Hamilton Health Sciences, which is another regional cancer center here in Ontario. It's a great fruit lax that you can make in bulk, keep in the fridge for a few days, and you can also use it in muffins as well. I'll leave that on for another second for you to copy it down. So sore mouth is another huge one that happens. One of my specialties in the cancer center is esophageal cancer. I deal with a lot of those patients, unfortunately, and their course of treatment is quite rough. And sore mouth could really contribute to a no appetite, no intake, dehydration, and them ending up in hospital. As well, there are some chemotherapies, for example, like Fulfuri that can cause mouth sore. So it's definitely good for you to mention this to your patients, which I'm sure you do. And if those patients who are listening, hopefully this could be helpful for you. The important is to have soft, moist foods. I encourage you to eat the regular foods you like, but put extra gravies on it and sauces. You can definitely work on extra mushroom gravy if they're still incorporating meat in their diet. That's something they can do too. Mac and cheese works really well too, and you can do it obviously a plant-based way as well. Also asking them to sip liquid throughout their meals to keep the hydration going. There is also other things to keep to account. Do the patients have thrush? Do they need a prescription for nystatin? How are they doing brushing their teeth? I often ask to see their mouth because sometimes the dietitian catches the thrush and then I make a recommendation to the nurse practitioner or physician to get some nystatin on board, because just quickly clearing up that infection can make a huge difference on their intake. So taste changes is something I talk about with my patients daily, even today. This can make or break your meal. And, they feel that something's wrong with them. They feel like it's in their head, and that's not true. I've had some patients tell me that the piano in their home smells bad. So if they sit close to the piano, they can't eat. Or their kids have brushed their teeth and they can smell the toothpaste and they get sick and they can't manage. So here are some really hands-on tricks that can help you give some ideas to your patients. So things that are sometimes warmed up actually have a smell to it and taste different. So I encourage some cold food. For example, if you made like a pasta dish, maybe put in the fridge for a little bit so it's not a hot smell. Or if you do have any support system at home, go outside while the cooking's happening. So when you come in, it doesn't smell like cooking. Have the windows open and have some non-smelling dishes. And I know that sounds strange, but I do mention it here. So the first suggestion I make is for everyone to not use their own plates and their own cutlery. And I know that sounds ridiculous, but what's important to remember is that sometimes the cutlery or the dishes smell like the dishwasher, or they have that metallic taste when you put in the cutlery into your mouth. So it's important that you make that first suggestion. It seems so simple, but I promise you guys, it will make a huge difference. Also, you have to start to change what your taste is. So if someone is tasting really salty, sometimes I say for them to put sugar in their sandwiches. Or sometimes if the taste is off, believe it or not, plain potato chips is the magic bullet. And I know that's, how could a dietitian be suggesting that? But remember, this oncology world is a very different world. So it's important to I tell them, take the potato chips, crush it over your food or eat it, and it makes a huge difference. And if they're not eating well too, and having any kind of diarrhea or losses in that way, the potato chips also has great sodium and potassium. So that is my insider tip, guys, for today, is plain potato chips. Also, I wrote other things down, like keeping the window open, having a nice candle, having a nice smell in the house. I know that seems very superficial, but it makes a huge difference. Also, this is a great opportunity to teach them to use other herbs other than salt. If blood pressure is an issue for them, or they have hypertension in their past medical history, or at risk, of course, we all know our cancer patients also have risk for cardiovascular disease. This is a great way for them to learn how to use fresh herbs and spices, because that brings so much flavor to the dish without the added danger that salt does. However, having said that, if some patients do have a high blood pressure concern, sometimes during treatment, they're not eating as well, they've lost a lot of weight, and you have to kind of judge where they are and how their blood pressure is, and then you can make adjustments up to them. So nausea and vomiting, I need not bring that as a major attention point to you, everybody, but really having nausea really stops people from eating completely, and that actually makes it worse. So I know it's hard for the patients to believe that, or even yourselves as well, that the less the patient eats or misses hours with eating, the worse the nausea is going to get. Then they'll become dehydrated, then they'll become constipated and miserable. So again, it's this entire circular cycle that happens. So it's important that they eat small, frequent meals. Just try. So I say, if you can have those salted top crackers, and I say salted because if they're vomiting, they're going to be losing a lot of electrolytes right at their bedside. Or we have like plain digestive or social tea cookies. Something plain and starchy is really going to help settle the stomach and then get someone ready to start to go for the day. If they skip and now it's midday and they haven't eaten, it's really hard to play catch up. I think foods served that are cold, again, don't smell. And if we can get past that smell or that initial sense of that sensation in their mouth, then we can move forward. Sometimes as well, I do work together with the physician to recommend some anti-nausea medication 20 to 30 minutes prior to eating. And that's going to help them just get over that hump and then work together through these suggestions. Peppermint tea works well, and ginger is a great way to help the patient, either doing ginger fresh in some warm water in a pot and then drinking it, or even if they feel like they want to have some flat ginger ale. These are all things that are really going to be helpful. So timing is everything, like I mentioned. It's really important that we try to not skip meals. Same way the physicians, and I know you always mention, don't skip your pain medication either, because then they're playing catch up. The same thing goes as food. You have to start to think of food as medicine and not just something that you just get added on when you feel like it. If we can work on small, frequent meals that are meaningful, meaning have some protein, for example, like the peanut butter, that's very bland and mild, that you can put on top of those digestive cookies that I have shown at the bottom there. Or simple baked tofu. These are all mild tasting foods that really do help across all cultures. Here in my cancer center, there were so many vast cultures and often having to work with many different eating backgrounds and likes. So it's really good to get used to the different culture foods and what is out there and trying to help the patient incorporate what they're used to eating and how it can help with their treatment. Lack of appetite, I'm sure all of you hear that all the time, and it happens from time to time. But you know what I've noticed is that the patient is never going to feel hungry. So I say, don't wait for your stomach to tell you anything. It's important that you just look at the clock. And every 2 to 3 hours, it's important that they try to do something. And if they're not eating anything, I'm at the school of thought that I don't care what it is, even if it's like junk food, even if it's like they want a chocolate bar or they want some potato chips or a pudding, I'm happy. I'm happy that they're doing anything, just as long as they get something in. And you know, sometimes the family members get upset and they're saying, Michelle, they're not eating anything. They just had, you know, a cookie today. I said, that's amazing. 1 to 2 hours, why don't you sit with them and offer them something else? And I would definitely do it very small portions. The picture that's shown here is a great example of too much on the plate. And that can really turn off people. So it's best to have small little portions, maybe use smaller side plates and introduce it very slowly. And sometimes I work with family members to try to hide things or manipulate the food without telling the patient, not that I want to be lying to them or misleading. It's just that if I can try to hide some protein powder in there or trying to make some extra avocado in a tomato sauce to get some extra good fats in there, it's best that we just try to do that. And sometimes if we tell them, oh, this is in there and this is in there, they might say, oh, no, I don't want it. And they won't even attempt it. And I wrote here too, set the table, nice plates, a nice centerpiece. I know that sounds really superficial, but just think of yourselves. You love to come home and the house is clean, or you have your bed nicely made. It just makes you seem happier. So just doing these little things can make a huge difference for the patient or for your family member that you're taking care of. Weight loss is unfortunately an inevitable side effect of cancer, even prior to treatment. Like I mentioned before, I work a lot with esophageal cancer patients, and sometimes they come to me, or even my pancreatic patients, with 30 to 40 pound weight loss, even before they even start treatment. So it's already, we're starting at a negative. So the key is to do small, frequent meals. I know I've said that a bunch of times already, but that is so important. And small could be 1 apple with some peanut butter, or like some non-dairy cheese and crackers. It could be like little tiny things. It doesn't have to be an entire plate full. It's important to make things that are calorie dense. So if patients are going to have, let's say, a toast, and they're just going to have 1 piece, I sometimes suggest for them to put their spread, whether it's like a margarine or like a dairy-free butter or a peanut butter, on both sides of the bread that the side you normally eat and the side you normally just hold, put it on both sides. So if you're going to eat just 1 piece of bread, it's going to be more meaningful. Also, physical activity is really important. And I know sometimes patients think, oh, I'm undergoing treatment, I can't exercise anymore. I'm not asking them to do like bodybuilding competitions. I'm just saying, go out for a walk, be a little active. Because, you know, even for yourselves, if you're having a lazy weekend day, sometimes you don't feel hungry because you're not just exerting energy. So if they get out a little bit and just walk around the block, or even walk to the corner store or to the mailbox or anything, all that helps to get the appetite going and them to feel a little more quote unquote normal, not just a patient. So hopefully these tips will be helpful. You know, it does take time. It does take encouragement. So if you can refer to a dietitian if you have access to them, or just really encourage the family to go slow and easy, and really not to cause food to be a main argument within the family. I can't tell you how many times I've been a marriage counselor, and I have no business being that. But sometimes the fights ensue, and the stress and anxiety over food could really ruin the relationship of the family members. So leave it up to the dietitian to deal with that and talk to the patient, and let the other family members not feel stressed out about dealing with those issues. So juicing and blending, I'm sure some questions will come up about this. I can't tell you how many patients come to me on their first visit and say, don't worry, Michelle, I already bought a NutriBullet. I already bought a Vitamix. I don't understand. I've never learned in any of my schooling that immediately when a diagnosis happens, you need to go buy a NutriBullet. People are under the assumption that they can't eat food, that they have to just juice everything. And there's a lot of negative things to juicing, and it does take me quite a bit of my first assessment to kind of debunk some of these myths. So the problem with juicing is that many of our juicing don't have extractors that remove the fiber, that take out the skin, that take out all the good stuff of the fruit. And also it's the sensation of chewing and eating, if they physically can, depending on where their cancer is, that really helps with the happiness of eating and the taste buds. And if we take that all away, it just becomes a chore. And as I mentioned in the second point here, actually, that if we're just taking away all the fiber and reducing all the juice and just having the sugar, it's going to spike their blood sugar and then drop them down quickly. They're going to feel worse and they might start snacking on things that are not appropriate. As well, many of you may know that sometimes patients have to undergo some dexamethasone prior to treatment or throughout, between their cycles, a few days before and after, and this can cause and induce an underlying diabetes. Or if they do have diabetes already, I have many patients who are on oral hypoglycemics and have to move on to insulin. So doing juicing all day and not eating or having any protein can really, really wreak havoc on these patients who are borderline diabetics or who get pushed onto it from the dexamethasone or already are diabetic. And there's nothing worse than having the sugars in the 30s and 20s during treatment and feeling awful. And this is what I try to prevent. And working with diabetic patients is a very fine dance. And this is how I introduce that juicing may not be the best source for them. However, as I'll get on, there are some healthy ways to do juicing. So we'll move forward on that. So blending, and sometimes it's also called pureeing, I have to use very, very often with my patients, especially those undergoing lung radiation, esophageal radiation, not so much the lung with the chemo and the esophageal with the chemotherapy. Mainly with the radiation, it does happen that their swallowing is compromised, dysphagia sets in, and we need to do blending. So I have a comprehensive handout that I work with them on how to properly puree their food that not only is nutritious, but is also appetizing. Often people just throw a bunch of stuff in as a whole bunch of mush on their plate and the patient just pushes it away and then calling me that they're not eating. So if we're going to be blending a meal, I would suggest keep the starches, let's say potatoes, rice, quinoa, anything kind of one way separately. And I would mix it with like a non-dairy milk or a veggie broth and then blend that. Then I would blend separately the vegetables and blend the protein separately and place it on the plate on those three separate kind of categories. So kind of still looks like a meal. And you can pretty much puree anything. I've tried almost everything. And I can tell you with certainty that pizza and French fries is a total nightmare to puree or blend. So definitely at your patients, don't even try that because that's awful. But it's important when you're blending is now is an opportunity. You can put extra fiber in there by putting in some chia seeds or hemp hearts mixed together in with the smoothies or with your food. You can also put in protein powder. There's many different protein powders. I kind of recommend tasteless ones so it doesn't influence the taste. You could pick flavored ones too, like vanilla or chocolate. If you're doing any baked goods, they can hide the protein powder into the baked goods if they're making it at home. And when I'm doing blended drinks, even for myself, I try to make sure that I have all three macronutrients into the blended food. So I always look, is there a fat source in there? So do I add in some frozen avocado, for example? Or do I add in some nut butters that I get a good source of protein and fat? Do I have vegetables in there? Do I have fruit in there? So most of my smoothies that I do make have a combination of all the macronutrients in there as well. So that's just a little quick thing on blending. Also, I'm not sure if any of the hospitals there in the UK offer like pre-done puree meals. Our hospital sells small kind of frozen meals for patients to take home that's easier. So this is something you can always look into if this is something that the patients could partake in if they're exhausted and fatigued from the treatment, which most are, because who feels like going to treatment all day and then coming home to cook? And I think from a plant-based point of view, most patients are scared or are timid to move into plant-based because they think it's a lot of work. But I really try to work with them that it's actually so much easier than thinking about cooking meat and standing in the stove and cooking in the oven for hours and like a stew and all this. You have to make sure the meat's cooked thoroughly through, because doing plant-based is a lot quicker, it's a lot easier. And from a food safety point of view, I mean, there are concerns too with juicing about getting unpasteurized foods. It's important that you always take the time to discuss food safety with your patients, because if they're eating any raw, unpasteurized foods, it could be dangerous since their immune system is compromised. So that's a question that I get asked often too about unpasteurized products and making sure things are cooked properly and worrying about contamination. So as I mentioned, the last line here, people say they want to get juices from stores, but I always worry, like, is the store cleaning their juicer properly? Are they cross-contaminating things? Because our patients are so vulnerable during this time, it's important that you let your patients know that getting food from outside and takeout is fine because they're exhausted, but they should be mindful of where they're getting it from. And natural is not always healthy for them during this time. I'm not sure if your ministry there or organization has handouts on food safety, on how long things should be refrigerated, or for example, once you defrost something, you shouldn't refreeze it. These are tips that dietitians can really be helpful for to help make sure that the family who's cooking for them, or of course the great family or friends that want to bring things over, are following proper guidelines. And going back to my first point here, as I mentioned, it's always better to eat the fruit and vegetables than to just use it as a juice. Because again, it's this tidy of eating, it's the enjoyment of chewing and eating if you can, versus just drinking juice all day. And of course, it should not replace a meal because of the weight loss and because of the muscle loss that is so prevalent. It's important that if they do want to juice or puree or blend, that we work to try to make sure that all the macronutrients are in there as well as the micronutrients. And there's a lot of meal replacements out there, both plant-based and not. Some patients want to use those commercial products, which is totally fine. I help them with that. Or if they want to make their own at home, I have lots of recipes that I give out to the patients and make sure they're doing it in a safe way. Especially those patients who are at risk for small bowel obstruction and who have just come off fluids only or need to be fluids only for a short period of time. It is crucial that it's not just water and broth, that we work together as a team and a holistic approach of trying to make sure that their meal is completely balanced. And often during this time, I do work towards plant-based eating, because it's whole plant-based eating is not going to be good for them just now during treatment, but moving past into survivorship, or if survivorship is not their course of journey, it's also going to help them manage symptoms. And most importantly, if they have any children or family members, this will also get them on the right track. I find that this is the most opportune time to teach them about healthy eating. And I think they're ready. I think they're ready to listen and they're keen on learning. So this is a great time to do that. These recommendations are fantastic. Now, I put this website up for you on my resource page, but also I put it up here. It's the American Institute for Cancer Research, or you can go to aicr.org. It's a great website, a great organization. And yes, it's US based, but I haven't found such a great counterpart like in the Canadian version. So they have great recipes, they have videos there, and it's all reputable evidence-based information. And as you notice, even though they're not a plant-based complete organization, their guidelines does support it. And they're in the same school of thought as I am, even though I'm plant-based personally and have been since I've been 12 years old. I am there to help the patient, to meet them where they are. I never push them to do this. It's never an all or nothing approach, because you don't want to lose the patient. You don't want them to shut you down and to not listen. So it's important that we keep being open-minded. I just had a patient, I too, one today who was completely plant-based, who I was helping to have energy dense foods because he was losing weight. So we were working on making a non-bake energy balls to have in the fridge. So he was really keen on cooking those. And then I had another breast cancer patient I spoke to this morning that wants to go plant-based, that understands the importance, but is afraid because she still eats fish. And I said, that's okay. That's okay. We can still do what you like to do and enjoy, and we'll start to incorporate more of the recommendations, not only from the American Cancer Institute, but also from the WHO organization that puts out their guidelines. So, and I do like to share with them the evidence-based. Everything I do as a dietitian is very evidence-based, and that's part of my as my college, my regulation is I only show people what's evidence-based. Of course, if people want to try things that are not really substantiated with scientific evidence, I look at it. I don't want to say to them, no, don't do it, because I don't want to shut that door of communication. I say, okay, let's look at this herb. Let's see if it interferes with your chemo or with your radiation. And I work with them on that as much as possible, because I know here in Canada, and I'm sure over there too, 100% of the patients want to do some naturopathic things and will do it whether we support them or not. So it's better to be open-minded, include lifestyle medicine into your practice, and not be afraid to discuss these herbs that you may not know. And it's okay to say, I don't know. I say that many times. I say, I've never heard of this one before. Let me look it up. Or I contact my naturopathic colleague at the Naturopathic College who can help me be familiarized with these herbs and if they do interfere or not with the chemo. And it's great when you're open with the patient in terms of plant-based and introducing other non-medical suggestions, because it allows them to know that you're listening, that you're supportive, and that you're letting them be part of this process, instead of them just being the patient that are getting things done to them. Like, they're part of it together with us. So, that's my number one takeaway, is to really be open, share the medical evidence with them. And when they're ready, they'll be ready. And it's important to meet them where they are, not where you are, because that's going to ruin your, professional relationship with them and end the lines of communication. So, I know I said like a million things during this presentation, and it takes a long time to work with patients. So I'm looking forward to your questions, and hopefully I can be helpful with anything you want to talk about. Here are those websites. So I did put up AICR, like I mentioned. This cookbook, this recipe book here by Jean LaMancha, she is a registered dietitian. It's not a completely plant-based book. However, it has really good healthy recipes and really good reputable information that might be good for you to have in your cancer library at your facility. And so I'm open to that as well. The Go Down Easy book is a great book that was written by the Princess Margaret Dietitians. That's a cancer center in downtown Toronto. And it has a lot of great recipes. Again, not all plant-based. However, they can be adaptable to those who are undergoing treatment, who have dysphagia, who have nausea, vomiting, and it's broken into categories. Many of you probably are known the Memorial Sloan Kettering website, which is great. And the BC, that's the British Columbia Cancer Society agency, has great resources on there. So that's another one that you can go to as well. So I'm sure you'll have great resources to share with me too that I would love to hear about. But let's get back to Rohini and see if there's any questions that I would love to answer for you guys. So thank you so much for listening, and hopefully I didn't say way too many things for you guys.
Thank you so much, Michelle. That was incredible. I learned so much from that presentation. I honestly think it's the most practical, hands-on presentation that we've had in the webinar series. And Actually, so many of the tips I thought were so useful for a range of conditions. Even when you were talking about nausea and fatigue, obviously that applies in so many different medical conditions, and the tips around, you know, putting the avocado into the tomato sauce. I just loved everything. It was really fascinating, and we've got some great comments and questions. So before we get into those, I know your personal story and I think it's incredible, so I'd love to sort of ask you a little bit about how you became a dietitian, how you became plant-based. That would be really interesting for everyone to hear.
Sure. So as you know, I've been a plant-based eater for a long time, but it didn't start just because I wanted to. Under the age of 10, I was diagnosed with hyperlipidemia. So it's family related cholesterol, it's genetic. And I was a very, very skinny kid, and it was hard to imagine that I was so fat on the inside. So under the age of 10, I was going to the hospital for sick kids every 3 months for blood work and meeting with a dietitian to learn about label reading and what to eat and what not to eat. And even back then, which I believe is like the Stone Ages, because I feel like I'm 100 years old, it was pushing plant-based, avoiding animal products. And so that's when I was 12. And now I won't tell you exactly how I am, but I am in my mid 40s, and I've been able to keep my cholesterol under control. Having said that, genetics does catch up with you. And I don't want you to think that I'm a perfect plant-based eater, that nothing really affects me. I did have a cardiovascular episode in 2017, which did have a huge wake-up call. And to be honest, I felt like a total failure as a plant-based eater. And I did now have to start many, medications, which was very hurtful for me. I was actually crying with my cardiologist that I had to start medications, and I kept saying I'm a failure. And he said the most important thing to me. He said, you know, Michelle, you have done so amazing your whole life being plant-based. If you weren't, I'm sure you would have had a heart attack in your 30s. And he goes, you've done amazing, keep doing it, but let me help you with medicine the rest of the way. So that's how this all started, you know, and I'm very candid with my patients who often say, you don't understand what it's like. Yes, I don't understand what it's like to have cancer, but I do understand what it's like to have a chronic disease and to feel like there's no hope. But I'm telling you from personal experience that eating this way has really saved my life. So that's my little story. And Brenda Davis, if she's listening or will listen to this, I want you to know that back in 1980 something, I was the only one who's vegetarian in my family, and still is the only one. I went to the library and I took out her book, Becoming Vegetarian. And that is the first book that helped me ever learn, because there was no internet when I was growing up. So I used her book, and for me, she's like my little hero.
I think many of us can relate to that. That is such a beautiful story. And I think your compassion for your patients really comes across. And of course, you know, sharing that so honestly is really, really beautiful. And I think so many healthcare professionals listening to this will relate to that feeling, because of course, you know, we really shouldn't have space for medication shaming in this movement, where everything you've talked about is really how nutrition can play such a big supporting role alongside cancer treatment. And it's important to emphasize that, the evidence-based nutrition. And I think, you know, I think all the work that you're doing at Plant-Based Canada with Zara is wonderful. So let's dive into the questions. Otherwise, I'll have some angry people because I have a lot of questions to get through. So one of the questions that's come up a few times is about probiotics, and it's with regards to what would you say to patients who want to take probiotics during cancer treatment? And specifically, one of the questions was, what about when they have diarrhea during treatment? Are probiotic supplements suitable?
Perfect. That's a great question. So it's definitely an interesting question, because if they're undergoing chemotherapy, the risk of getting infection if they have a port or PICC line is very high. So together with the pharmacist, we actually don't recommend for them to do probiotics during chemotherapy treatment. The fear of like powder, if they're mixing it like lactobacillus or different type of powders, could actually come airborne and could potentially affect the PICC or the port. So I know that sounds pretty extreme. Like I'm sure the patient's not throwing powder all over the place, but there is that risk. And plus, some patients are getting their probiotics from a non-reputable source, and we don't know what kind of live bacteria is in there. So that is really what I worry about. If they're not on chemotherapy and they're on either immunotherapy or they're on radiation, I do say, okay, if you have diarrhea and you've been on antibiotics or you've come from the hospital, you've had C. difficile, let's work on making good health for your gut. Because good health for your gut is really the be all and end all. That is one of my biggest things, known as, of course, I'm diarrhea lady. So why wouldn't I love gut health? So doing a probiotic that's safe and that's from a safe resource, I totally say yes, thumbs up for diarrhea for that.
Okay, that's really great to know. One of the other questions that's come up was about, do you have any recommendations for anyone who's had recent lower GI surgery who wants to try a plant-based diet, including patients that have a recently formed stoma?
Perfect. So if you have an ileostomy, that is a very emotional stoma. So ileostomies, I always say, are more emotional than colostomies, meaning that because they're lower down, they're higher up in the gut than the colostomy, they tend to be a little more like finicky. So I would say for the first 6 to 8 weeks, I would definitely follow the low fiber diet. And then I would slowly work together with your dietitian or your GI physician to slowly move into higher fiber. There are many patients who have ostomies who are plant-based that I work with. They think they can't have beans or lentils or legumes. That's not true. We can do it. We just have to do it slow and steady and use some of those white starches that I put up on that list and those vegetables and fruit that are safer during that time. And then we slowly work into it. And then after the 6 to 8 week mark, the ostomy starts to calm down, except times during the chemo cycle, they do get a little bit finicky, but work together with your dietitian and it can totally be done.
That's really good to hear. Another question that came up was about the fasting mimicking diet, and if you have any thoughts on that for patients during cancer treatment. And
so I'm very interested in this topic. So we go through waves of information, like, when cancer research started, like even back in the 1800s, they thought of starving the patient, which obviously did not work, and the patient died because they were completely malnourished. Now it's very interesting. I've had 1 or 2 patients who have come to me interested in doing this. So from the research that I've read, a lot of it are animal studies, but there has been some human studies doing this mimicking intermittent fasting. And it's really looking like it's 3 days sort of before chemo and then a day after. Now it's completely not just water. There is some stipulations like veggie broth, and it is low calorie. However, I must say that I've been very selective on patients who want to do this. So it has to be on a patient who's stable, who doesn't showing signs of major sarcopenia or muscle lossing or malnutrition. I tend to steer away from those who are like pancreatic, lung, esophageal. They're more at risk for malnutrition. And I worked with someone who was a prostate patient who was interested in doing this, and breast patients. So the research is emerging. There are a few papers out there. I am totally loving it, and I can't wait to try to see where this goes and how nutrition evolves. So I think there's a place for it, but I don't think it's for everybody.
I think that's really good to hear. I think kind of waiting and seeing where the evidence comes out around this. How about the question around how do you manage all of these issues with patients who are overweight and particularly obese? Obviously, that is quite a high percentage of people who are going through cancer treatment. What is the nutritional approach that you recommend? And specifically, could you address weight loss as well within that?
Perfect. So like I say, for any intern that comes with me that I'm helping to train, it can get really overwhelming when a patient comes to you with, yes, they're there for cancer, but they were a person before that, and they have like a multitude of comorbidities, whether it's obesity, diabetes, hypertension, heart disease. Like, how do you rate them of importance? Yeah. So what I'll say at the first moment is, if someone has diabetes, for example, and is obese, but they're here for cancer treatment, I always say, let's work on your nutrition to get you through treatment, because I don't have a pill to help you with your weight loss, that you're losing all this weight. But I do have medication to manage with your diabetes and with your hypertension. Not to say, have ice cream all day and who cares if your blood sugar is 30, because I do care. But if someone comes in obese, it's very likely that they're also malnourished. And I know I spoke about that in the presentation. Yeah. I know it's very hard I know even the physicians I work with to wrap their head around that someone comes in obese and how could they be considered malnourished. When I take the diet history, it's amazing how low nutrients they're eating. So I try to work with them, not thinking of weight loss, because starting cancer treatment is not a time to get bikini ready. Okay, this is not the time to get ready to go, but it's a time to work on making quality happen with your meals. And then naturally they're going to lose weight, unfortunately, with treatment, but we can do it in a less severe way where people lose like 5-10 pounds a week.
I think that's, that's brilliant to address that, because I think just addressing kind of weight loss without looking at the diet quality is not the right approach. So it's really good to hear you say that. I would love to know about any patient-ready resources. A lot of people have been saying how fantastic this webinar was and how they wish that people who had cancer had access to someone like you, but unfortunately we can't replicate you. So what are the best resources for people who might have cancer, or for other healthcare professionals who might be advising people who have cancer?
Right, so the best thing is if you have access to a dietitian, whether my whole practice is oncology, but if they do something else, they're all going to be familiar with helping you plan effective diets. Going to reputable websites is so important, especially now in this pandemic time when a lot of us can't go to the library or go into the hospital that easily. The websites, like, you want to go somewhere reputable. If I type in nutrition and cancer, it's ridiculous how much comes out. And you want to make sure what you're looking at is not just people trying to sell you something, because that's just awful, people taking advantage of people at this time. So like I said, the AICR website's really good. Mayo Clinic's excellent. The BC Cancer Agency has great resources. Even the Princess Margaret Hospital website has handouts and website resources right on the website for you guys to take. So that's great. And, the Australian, because I'm part of Dietitians of Canada, I'm also hooked up with, the UK resources as well as the Australian. And there's great resources that the dietitians can access there through our professional education network.
Wonderful. And just to mention to anyone who's listening, we do also have a fact sheet on cancer on the Plant-Based Health Professionals UK website. And that's more around cancer prevention, but do have a look at that because it's excellent. I'm going to launch the poll now, and just to get everyone's feedback, which I know will be amazing because everyone's been commenting in the chat box, but I think we've got time for one or two final questions. And one of the ones that comes up repeatedly is really around supplements. There are so many out there, and when you were just talking about people selling things, I think there are unfortunately lots of people targeting vulnerable people. And the industry around supplements is obviously massive, and there's a lot of obscure ones, a lot of new ones. Is there, what approach would you take with them? And could you just, I know you highlighted it a bit in your presentation, but it'd be great to hear from you about that again.
Sure. So, obviously people come to me on their initial visit and they want to take every single supplement they can find, but more isn't better. And sometimes things can be very harmful and interactive with chemotherapy. So the takeaway from this is high antioxidants in a powder form or a pill form is not recommended during radiation and chemotherapy, as it'll interfere with the efficacy of it. So often people think, I'm going to take all this vitamin C, but it could be interfering with the radiation and causing a barrier for the radiation not to be effective. Mm-hmm. So it's important that I say you can eat your nutrients. You can have blueberries, you can have pomegranates, you can have oranges, you can eat all this stuff. And normally, let's pretend we're not talking about cancer in an everyday life. We can get everything we need from our food, except for things like vitamin D. So I would say, sure, go ahead and do a vitamin D supplement. I know it's dark right now where you are. I know it's going to be dark for me in about an hour or so. And, we never get sunlight. As you can tell, I'm completely see-through. I never get any sun. So have to do vitamin D. And sometimes people do have to take B12. These things are fine. But antioxidants and taking all these things that people are trying to sell you breaks my heart, because it's not going to change your course of action and it could actually harm your treatment.
And how about iron supplements? This is a question from a dietitian who's a member of our group, saying that quite often when people are diagnosed with anemia, they're advised to start, and they're going through cancer treatment, they're advised to start consuming meat and or supplements, iron supplements. Yeah, so people say, oh, I think I'm low in iron, but if it comes back from blood work that they are and they need supplementation,
Sure, let's do it. We don't have to do meat though, because there's a lot of things that you can eat to help iron be more absorbed better, like doing vitamin C products, like having broccoli, red peppers with your meal. There's like endless amount of things you can do. So if they have to go on iron supplementation, we also have to keep in mind that they could also be constipated from that as well. And if they're on pain meds, so it's really multifactorial. So I would sit with the patient, I get their diet history, and then I bring them a handout of high iron sources, which often, like I said, people do not want meat. They get turned off from meat and coffee. And that could be someone who's 20 or someone who's 80. And it didn't matter what the cancer is. So I think working individually and not just giving a blanket handout to them. So that's why we try to tell our physicians, you can't just give them a handout. I sit with them and I go through everything they're eating and make exact recommendations for what they want to eat. So it'll be better buy-in that way.
Wonderful. I think we actually managed to get through all the main questions, which I'm really happy about. It's the first time ever, I think, because you covered so many things in your amazing presentation that you answered a lot of people's questions coming into this. But I just want to thank you again for your time and for your expertise. And there are so many people in the comments saying that they wish they had someone like you on their side when they were going through this, or that they wish they had you working in their team. So your patients are very lucky to have you, and we are very lucky to have your time this evening as well.
Oh, well, thank you so much for having me. It's such an honor. I have never been to the UK, so I would love to come when all this settles down, and then I can come see you and sit on that lovely sofa with you, Rohini, and we can like alive together.
And I will be sending around the links to your social media, but she has the cutest dog, Luna, who's been sent.
Oh yeah, she's right here, right beside me. So if you go on the plantbasedcanada.org website, every Monday and Friday, I do a post, and Luna is obsessed with taking over the camera. So you see me keep doing this because she consistently wants to get in front of the camera. So
yeah, so definitely go and check that out, and check them out on social media as well. And if anyone who wants to share this webinar with anyone, it will be available to Plant-Based Health Professionals UK members. So do encourage your friends and family and colleagues, other people that you meet, to join, so they can access all the previous webinars, including Dr. Shireen Kassam's incredible webinar the week before, which was all about using a lifestyle approach to improve cancer outcomes. So I think this whole month has been dedicated to that very important topic of cancer. Do share that, and thanks again for supporting us.